This is the Asaji Show. This is our health segment. Today, we are live at Living Faith Church, Area 3, Abuja, to witness the free medical consultation camp that is being organized by Troika Healthcare in collaboration with Avis Hospital, India, and Alliance Hospital, Nigeria. Today, people with so many health challenges will be examined free of charge. People with fibroid, disrupted fertility, anemia, and so on will be examined here free of charge, and then will be treated afterwards. Take a listen and hear what they have to say.
Dr. Rekha, and I'm from Avis Hospital, Hyderabad.
Avis Hospital, India?
Yes, in India.
Okay.
And this is a short stay surgery hospital. Why it is a short stay surgery hospital? Because whatever procedure we do in the hospital is requires only a short-term stay in the hospital.
Okay.
So anytime a patient comes into our hospital and does the surgeries or any procedures, most of our procedures are non-intervention, which is like non-surgical. We do it through wires, through cables, through cannula. So most of our operations are like less blood loss, less hospital timing, and early recovery. So that is why we call it short stay surgery hospital.
Short stay surgery hospital.
Yes.
Okay.
So we are here to help the people in Africa, in Nigeria basically, and we are here for 4 days camp, and we are doing it free of cost, and we are seeing a lot of cases, and mostly why we are interested, our basic area of interest is intervention radiology.
Okay.
This is the area no one has developed from any of the countries so far as I know.
Okay. Tell us more about it.
Intervention radiology is a specialty where like we can treat the fibroids without undergoing surgery.
Okay.
Yes. So there is no cut, no heavy blood loss, no 2 to 3 days stay in the hospital.
Wow.
And we can treat the patient in 1 day. But we need a machine. It's called cath lab. We need a cath lab to do all these procedures.
Okay.
We can treat the varicose vein. We can treat
arthritis.
No, we cannot treat arthritis with intervention radiology.
Okay.
We can treat like do a lot of like vein, arteries, and vein, which transfers the blood supply into our body. And if there is any balloon type of formation, we can help to treat those patients. And most of those cases are undiagnosed and not properly treated in most of the areas. So there are 2 ways of treating those cases. Either intervention radiology with the help of an intervention radiologist, or by a neurosurgeon or a general surgeon.
Neurosurgeon or
a general surgeon. But the cost of life becomes double if we do it as a surgical intervention. And if we go through an intervention radiology, the surgical cost becomes low.
Wow.
Then cost of living becomes low.
Okay. So cost implication is actually
low in this procedures.
Okay.
So intervention radiology, again, all the investigations, all the procedures are done under guidance of MRI, under the guidance of CT, under the guidance of ultrasonography, which we are doing currently now with a patient for the varicose vein, where he doesn't know that he has the problem, but he has the problems already with an open wound.
Okay. And then
yes. Okay. So we are going to see how his blood vessels are working and why that ulcer happened all of a sudden, and we can treat that ulcer with just a radio frequency ablation machine.
Wow. So all those things are being checked. The patients so far have consulted for it and they were checked.
Yes.
Is there any such case you have, the varicose vein and the fibroid?
We have found one varicose vein case, and which is like worst condition. And because most of the time we neglect varicose vein. Okay, because varicose vein happens in the leg area.
Okay.
Is
So early detection helps.
early detection helps. It is not a life-threatening disease,
Okay.
but still it can cause lot of like problems because all the blood vessels from the leg it is going to heart.
Wow.
Okay, so if there is a
There won't be
blockage
easy
in the
flow of
leg,
blood, okay.
then the heart will not get proper blood supply. So
course.
what will happen in due course of time, like after 5 years, 6 years, 10 years of time, there would be an ulcer. Then the leg will die because of non-blood supply, and the heart will also suffer after some time.
Wow. So
But these,
good.
but one need to know that yes, this is the problem. This is how we can be treated. It can be treated. So by going for a small procedure, which is called radio frequency ablation for the varicose vein, we can treat the varicose vein, and after that we can help ourselves by not getting into cardiac disease, not getting into heart disease, not getting into any arterial disease.
You are specialized on
Yes,
very
or
few,
not cutting the leg even.
Okay. So what's your parting words finally to those your audience watching you right now? What is your parting word to them? So that anytime they see such opportunity, they can always avail themselves the opportunity
Yes,
and come for this medical checkup.
of course. They should always come for a medical checkup. And in African belt, what we have seen that lot of women, they suffer from fibroids, uterine fibroids. And most of the time, doctors prescribe for hysterectomy, that is removal of uterus, or either a surgical operation to remove the cyst or the tumors in the uterus. But now what we are saying that don't go for the surgery
anymore.
Yes.
Since there is a new procedure called
There's a new
uterine fibroid
embolization.
embolization.
So we are also looking for some opportunities to do it here for the people, as the economy is not
to save costs instead of flying and pay for a flight ticket and then
visa, stay. Then you are away from home. Then somebody has to take care of your family as well, or something like that.
Okay.
So we are trying to come here and looking for some hospital setup.
Partner with them and then have
with them, yes, so that we can set up that cath lab type of sort of thing, and then we can start this procedure here
in
itself.
Nigeria.
My name is Dr. Raja Kopala, and I am a vascular interventional radiologist. So what we do is we use the blood vessels and use them to treat patients. So the main specialty that I'm here for is to treat uterine fibroids. So when women have fibroids in the uterus, what happens is there are some small vessels that go into the fibroid and give the food for the fibroid to grow bigger and bigger. What I do is I do an angiogram and I block the vessels that go to the fibroid, and that makes it easy for the fibroids to shrink in size and it becomes manageable. Now the other alternative, previously before this, the other alternative what used to be to cut the uterus and remove the fibroid or remove the uterus itself. What that does is that would mean that you cannot have children easily because the uterus is removed. Or you could, even if you did a myomectomy, which is just cutting and removing the fibroid, it always comes back.
Yes, after a while.
Correct. So when we do this procedure called as fibroid embolization, which is blocking the vessels that go to the fibroid, it's all done internally, and the fibroids all shrink in size immediately, and within 3 to 4 months she becomes free of fibroids. But the beauty of the procedure is it just lasts half an hour, and 4 to 6 hours after the procedure you can go home. And from next day you can do basic activity, and from 1 week later you can go back to work, proper work. There's no cutting, no stitches, no anesthesia, no injection of any, no infusion of blood. So it's nothing like that. So it's a completely safe procedure that removes the fibroids but retains your fertility. The other procedure I do frequently is what's called as varicose veins. So when these little veins in your leg get big and blood does not flow well through those veins, I put a small catheter called laser, and I use the laser to just shut those veins and make the blood flow normally. And that's a very important procedure, because for that also the other alternative was to cut and remove the veins, which is extremely painful and requires anesthesia and all that. Whereas when we do laser for varicose veins, it's just again half an hour procedure, and 2 to 3 hours later that patient can go home and do all the activities. There's no rest whatsoever. They can go to work from the next day. So these are called minimally invasive procedures, which make sure that the patient goes back to work as soon as possible. They require a lot of extra equipment for us to do, but then at the same time the patient recovery is superb and fantastic.
And then the cost implications, since you're here in Nigeria, becomes
the cost implication actually, it's if you count the fact that the patient does not require any leave off work, can go back to work immediately, and the fact that both laser for varicose veins and fibroid embolization has 97% success rate, which means you don't have to repeat the procedure. If you compare all that together, the cost is actually much cheaper than traditional surgery. Because traditional surgery, on the face of it, it costs this much, but then there's anesthesia extra, there's so many more medicines extra, then you can't go back to work, then you have to take rest, then somebody else has to stop their work and look after you.
exactly, and then the cost of flying, your air ticket,
Correct,
and all of
so
that.
all that. So that all that can be changed, and this process can be done very safely here.
So what's your parting words to those watching you right now, so that anytime they see such opportunity, they can avail themselves of the opportunity to come and consult
Correct.
medically? Yeah.
So my parting thoughts is that all of what I've said and what I've discussed is available on the internet.
Okay.
I request patients, whenever they're being advised a traditional cutting surgery,
Okay.
anywhere of any kind, I request and ask them to see if there are any alternatives, wherever it be in the world, and see if they are available nearby. And that way, if patient becomes an advocate, if patient understands that this is something that she or he cares about, then that's the best way. Because I realize that a lot of physicians sometimes don't do what's necessarily best for the patients. So then this is the best way of overcoming that, because you are now knowledge, you're aware. So I, for example, give this big brochure to everyone. They can read about it. I give them 5 websites that they can check it out. They're not my websites, they're international websites.
Okay.
And that's how they empower themselves, and they can learn more about these procedures.
I'm Pragya Singh Rathore.
Okay.
I am from Troika Consulting Limited.
Okay.
We are basically healthcare aggregators, and we are here in Nigeria for the past 12 years.
Okay.
Now what we are doing here is as part of our social responsibility, we are doing a free health consultation camp
Okay.
here at Living Faith Church, Durumi, and we still be having the same camp for the next 2 days at Alliance Hospital in
Okay.
Garki, Malumfashi Close,
Okay.
in association with Alliance Hospital.
Okay.
And the doctors, we have invited doctors from Avis Hospital, Hyderabad, India.
Okay.
So what actually brought me here, because we have seen that there is a large number of ladies who are suffering from fibroids,
Okay.
and because of the fibroids there are disrupted fertility and all those issues comes
Anemia,
after
okay.
anemia and all. So because of fibroids, now till now what was happening, that fibroids, they used to remove fibroids through laparoscopic surgery or through open surgeries.
Okay.
But now there is a new technique called as UFE, that is uterine fibroid embolization.
Uterine fibroid embolization.
Yeah,
Okay.
that's it. So what the technique basically do is we embolize the
Okay.
fibroid,
Okay.
and this is done by using the fact that all the fibroids to grow they need a blood supply. The fibroids are basically supplied by tiny blood
Yes.
vessels. So what we do basically is we take advantage of this fact.
Okay.
And there's an interventional radiologist, Dr. Raja, who's consulting here
Okay. From India.
from India, Avis Hospital.
Okay.
So he is an interventional radiologist. What he does is they insert a catheter through your femoral artery.
Okay.
So the catheters actually travel through inside the artery.
Very
the
tiny
blood-
object that you can hardly feel.
Exactly.
Okay.
So once it reaches the base of the fibroid, it now injects a gel-like substance which is bigger than our RBCs.
Okay.
60 times bigger than the
Wow.
normal RBC size. So it actually blocks the artery.
Okay.
It blocks the blood supply to the fibroid, and the fibroid dies its natural
Shrinks.
death. It
Okay.
shrinks.
Okay.
So these kind of things, this is something which has minimal blood loss,
Okay.
there is no the recovery time is very less.
Okay, the advantage is that there is minimal blood loss due to
That's
fibroid
right.
embolization.
And you are back to normal life within
few days.
Let's say 1 week maximum.
Unlike the other
procedures.
Okay.
So this is the new technology and which is not available. UFA is not the UFA is not happening here in Nigeria.
Wow.
So we want to start now. What we are doing is in association with Alliance Hospital.
Okay.
So we are trying to do the surgeries here very much in Nigeria and stop sending people outside the country to get treated.
Wow. At a reduced
cost.
Wow.
Because 20 people traveling to India for
Of
the same
course,
thing,
yes.
it's better we call 2 doctors from India
and
do
then
the
they
same
attend
surgeries
to
here.
you. Oh, it's much easier. Thank you very much. People are doing a great work. It's a laudable achievement. Keep it going. I believe once in a while you conduct such tests with your team of experts from India. Kudos to Troika Healthcare. Keep doing what you're doing.
Thank you.
And
Hi, I'm Dr. Sridhar Mustiala. I'm an orthopedic surgeon specialized in joint replacements and arthroscopy and sports injuries. I've trained in India for my undergraduation, and then I was in the UK for about 12 years and did my FRCS orthopedics there, and come back to India about 2 to 3 years back. I am attached to a couple of hospitals, Avis hospital being one, and it is a multi-speciality hospital with all facilities for joint replacements and arthroscopy. Today I am on a visit here to Nigeria, Abuja, and we are screening patients for knee replacements or spine surgeries or arthroscopic surgeries. We are here for 2 to 3 days, and we screen the patients, and any surgeries patients need, we offer them at a very concessional price in India compared to many other big hospitals. And any procedures, if possible, can be done here as well, provided the equipment for that is available here. Thank you.
I came here for free medical consultation by Avis.
Okay. Have you been examined by the team
Yes,
of
I've been
experts?
examined.
Okay.
And they are
Prescribed
yes, some drugs have been prescribed to me, so I'll go and try them.
Okay. What word of advice do you have for the audience watching you right now, so that subsequently when events like this is being organized, they can avail themselves the opportunity?
Well, the advice is that since it's a free medical checkup, you lose nothing in coming. It's better to know your problem or challenges ahead of time than allowing it to compound and get deteriorate and get out of hand. Actually, why most people don't go to hospitals in Nigeria is because of the consultation fee. They feel that they can't afford it. But since this is free, people should afford themselves.
Absolutely.
If it's a question that you can't buy drugs, then it's another issue entirely. But since it's free, I will advise everybody to come around and avail himself or herself of this free medical consultation.
Okay. So what do you have to say concerning the organizers of this event?
Yes, it's well organized. I thought I would spend some time and things like that, but everything went on smoothly.
Okay.
I came, they said, sit down here, take your weight, do this, do that. Okay, you go in. I went in. It's a smooth process. Wow. Keep it up.
Coming for medical checkup.
Okay.
And they have checked me, they confirm what I've been hidden in my body. Formerly, I've been more than 12 years. I've been searching for how to cure myself.
Okay.
But the doctor now explained to me,
Okay.
they have settled every my case.
Wow.
Now I'm waiting for results.
Okay.
They give me the result and give me the medicine I will be using. So I appreciate what they did for me, and I appreciate the
Troika and the Avis hospital in
India, that they come. If this kind of people, they Nigeria, most of people that have less privilege,
yes,
benefit,
medical issues,
they will benefit of this kind of thing. So the challenge is too much rampant due to the condition of the country.
Okay.
People have no money
Okay.
to take care of themselves, but the kind of help assist these people do
Makes
is
it
very
easier.
it makes everything easier.
For the average Nigerian.
That's for.
So you really appreciate
I
what
appreciate
Troika and
I appreciate what they did. I appreciate what they did.
thank you.
And
So
I
you
thank
follow up on your checkup afterwards.
Yes, I will follow up my checkup after giving me my result with some medicine that they promised they will
Prescribed
get
for
me.
you.
Yes, of course.
Thank you very much, sir.
I'm very grateful.
This is where we'll be wrapping it up today on our health segment. on the Asaji show. Today, a lot of beneficiaries were examined on different health challenges. I've learned what uterine fibroid embolization is all about and some other things that I learned from the team of experts that came. Until I come your way again next week, same station, same time. I am your host, Asaji, and keep watching the A&G show. Bye for now.